Every year, thousands of capable nursing students complete nursing school but never become licensed nurses. Others spend months or even years retaking the NCLEX, not because they lack the intelligence to become excellent nurses, but because no one identified their struggles early enough or provided the individualized support they needed to succeed. In 2024 alone, more than 317,700,000 candidates took the NCLEX RN, while approximately 82.2% of first-time candidates passed. The pass rate for repeat test takers dropped to just 42.8%. These numbers represent tens of thousands of future nurses whose careers are delayed despite successfully completing nursing school. At the same time, the United States continues to face a significant nursing workforce shortage. The U.S. Bureau of Labor Statistics projects approximately 194,500 registered nurse openings every year over the next decade due to workforce growth and retirements. Yet, every year, thousands of capable future nurses never reach the bedside, not because they lack potential, but because they lacked the individualized support needed to successfully navigate the journey. Adding to this challenge, nursing schools are forced to turn away more than 80,000 qualified applicants each year, largely because of faculty shortages, limited clinical placements, and resource constraints. Every nursing student who graduates, becomes licensed, and enters practice represents an invaluable contribution to meeting our nation's growing healthcare needs. But the challenge extends beyond simply increasing the number of nurses entering the workforce. Our healthcare system also needs a nursing workforce that reflects the diversity of the communities it serves. Although the nursing profession has become increasingly diverse over the past decade, it still does not fully represent the racial, ethnic, cultural, and linguistic diversity of our nation. According to the National Council of State Boards of Nursing, approximately 76.6% of registered nurses identify as white, while 8.6% identify as Black, 7.9% identify as Asian, and approximately 7.2% identify as Hispanic or Latino ethnicity. Research has consistently shown that a diverse nursing workforce strengthens culturally responsive care, improves communication, builds trust between patients and providers, and contributes to reducing health disparities. Every capable student who does not graduate or never becomes licensed represents more than one less nurse entering the profession. It is also one less opportunity to strengthen the diversity of our nursing workforce and ensure that future patients receive care from professionals who understand their language, culture, experiences, and communities. At Gab-Nic Excelsior, we believe every nursing student deserves more than a standardized review course. They deserve a personalized pathway to success. My name is Dr. Nicolette Piobert. I am a family nurse practitioner, registered nurse, nursing professor, NCLEX educator, and founder of Gab-Nic Excelsior. Throughout my years of teaching, one truth has become clear. No two struggling students struggle for the same reason. Educational research continues to support this observation. Student success is influenced by much more than academic ability alone. Learning behaviors, confidence, resilience, financial stability, mental health, family responsibilities, access to support, and life circumstances all contribute to a student's ability to persist, graduate, and ultimately become licensed. Some students have knowledge gaps, others struggle with clinical judgment, some battle test anxiety, Others have ineffective study habits or difficulty applying what they know. For international nurses, the challenges can be even greater. Many are adapting to a new healthcare system, a new testing format, a different culture, and often a new language, all while trying to build a life in a new country. Many internationally educated nurses are also navigating credential evaluations, immigration requirements, employment opportunities, cultural expectations within the U.S. healthcare system, and the financial realities of relocating to another country. Their journey extends far beyond preparing for the NCLEX. These nurses also bring extraordinary value to our healthcare system. They contribute diverse perspectives, multilingual communication skills, cultural understanding, and lived experiences that enhance patient care. Helping internationally educated nurses successfully transition into practice strengthens not only our workforce, but also our ability to care for increasingly diverse patient populations. Many students are also balancing work, family responsibilities, financial hardship, transportation challenges, housing insecurity, or limited access to resources. These are real barriers that affect learning, confidence, and academic success. Research consistently demonstrates that non-academic barriers, including financial hardship, food insecurity, transportation limitations, caregiving responsibilities, housing instability, and mental health challenges can significantly affect student retention, graduation, and licensure outcomes. Yet too often, every struggling student receives exactly the same solution, the same review course, the same question bank, the same recommendation to answer more practice questions. At Gab-Nic Excelsior, we believe that approach misses the heart of the problem. We begin by understanding the student. We don't simply ask, what score did they earn? We ask, why are they struggling? Because understanding what happened tells us where the student is today. Understanding why it happened allows us to build a pathway toward where they want to be. Our comprehensive assessment helps identify academic, behavioral, emotional, environmental, and personal factors that may place a student at risk. Rather than relying solely on grades or examination scores, our framework evaluates the whole student: academic performance, clinical judgment, confidence, learning behaviors, study habits, accountability, environmental influences, and personal circumstances to better understand the factors contributing to success or struggle. Then we develop an individualized success plan designed around that student's specific needs. Some students need help mastering pharmacology. Others need coaching in clinical reasoning. Some need accountability and structured study plans. Others need confidence building, stress management, financial resource referrals, mentoring, or guidance navigating life as an international nurse entering the U.S. healthcare system. Success looks different for every student, so support should too. That is what makes us different. Our coaching feels personal because it is personal. As students progress, we continue monitoring their development, evaluating their performance, adjusting interventions, and connecting them with the resources they need to overcome new challenges before those challenges become reasons to fail. We believe intervention should never begin after failure. It should begin when the earliest indicators of risk appear. Our monitoring system is designed to recognize those indicators early so students receive the right support at the right time. Our goal is not simply to help students pass the NCLEX. Our goal is to help them thrive throughout their educational journey and transition successfully into professional practice. Our vision extends beyond individual students. We believe nursing schools need more than another remediation program. Many institutions have invested in student success coordinators, retention specialists, academic advisors, and counseling services because they recognize that struggling students need additional support. One conversation in particular reinforced our mission. A student success coordinator from a nursing school reached out to me and asked, "How do you approach student success?" She shared that her institution was committed to helping at-risk students and wanted to learn how they could create a more structured, proactive approach within their own nursing program. That conversation reminded me that many schools are asking the same question. They recognize the need. They are investing in student success. They care deeply about their students. What many are searching for is a nursing-specific framework that helps identify students who may be at risk, understand why they are struggling, personalize interventions, monitor progress, and measure outcomes throughout the student's educational journey. That is the gap we fill. Gab-Nic Excelsior becomes an extension of your student success team. We serve as a virtual nursing student, success coordinator, retention partner, post-graduation NCLEX coach, and strategic advisor dedicated to improving student outcomes. Our developing student success ecosystem is designed to identify risk factors early, monitor progress continuously, recommend evidence-based interventions, connect students with appropriate academic and non-academic resources, and provide institutions with meaningful insights that support student retention and NCLEX success. Our vision is to help institutions move from reacting to student failure to preventing it. By identifying risk earlier, personalizing interventions, and monitoring progress continuously, we believe more students can remain in nursing programs, graduate successfully, become licensed, and confidently enter the workforce. Every student we help succeed represents another licensed nurse entering the profession, another life transformed, another family impacted, another community strengthened, and another opportunity to build a nursing workforce that is not only larger, but more diverse, more culturally responsive, and better equipped to care for the patients and communities it serves. By partnering with us, institutions gain more than an NCLEX preparation company. They gain a strategic partner committed to helping every student overcome the barriers standing between them and becoming a licensed nurse. Because student success is about more than passing an exam. Every unsuccessful NCLEX attempt represents more than a testing outcome. It represents years of sacrifice, financial investment, lost confidence, delayed careers, and one less nurse entering a profession that desperately needs them. It also represents a seat in a nursing program that had the potential to produce another practicing nurse serving patients and communities. It is about helping individuals overcome academic, financial, cultural, emotional, and personal obstacles so they can fulfill their calling, strengthen the nursing workforce, and improve healthcare in the communities they serve. When students thrive, institutions thrive. When institutions thrive, our healthcare system grows stronger. When more students become licensed nurses, we not only address the nursing shortage, we also help build a workforce that better reflects the rich diversity of our communities, strengthens culturally responsive care, improves patient trust, and creates better health outcomes for future generations. That is the future we are building, and we invite you to build it with us.